let's talk about one more thing. What does that mean, adequate health care under the Eighth Amendment to the United States Constitution? Here's something that it's really important that I think many people need to remember, which is your constitutional rights as a United States citizen are your bedrock rights, right? These are the minimal rights that you have that protect you from government oppression and neglect, right? From government oppression. So under the Eighth Amendment to the United States Constitution, the Eighth Amendment says that we can't put people in jail without giving them an opportunity for bail, and you can't put somebody in prison, that you can't send somebody in condition to cruel and unusual conditions. And a court has found here that the Department of Corrections systemically violates that right, and is that the people that are held in the Arizona Department of Corrections are being held in cruel and or unusual conditions. In violation of the rights. But that is a bedrock right. That is the minimum that you have. Every other right that you have, or rights and privileges that you have in the United States, are on top of those constitutional rights, right? Our founding fathers said that these rights are so fundamental. These are such fundamental rights that they don't need to be in the democratic process. They don't need to be, debated in Congress and voted on by lawmakers. These are fundamental rights. They are constitutional rights. They are bedrock principles and rights that you have as a citizen. So adequate health care under the Eighth Amendment is not wonderful health care. It's not, what you're getting down in Scottsdale or at the Mayo Clinic or something like that. This means that the minimal, it's the minimal health care provision of health care that's necessary to ensure somebody is not living in wanton misery and pain. And, so it's not a lot. Let's not think that this is a lot. And that's something that we should remove from our minds, thinking that, these people in prisons are getting all this health care. Well, the health care that you're provided out here in the world and what's provided in prisons is oftentimes very different. And out here, you get a lot of testing. There's a financial incentive for them to test and for them to treat you out here. The incentive is reversed in the Department of Corrections, meaning this. Out here, when you go to your doctor is acting in good faith. I don't say that they're not, but if they can get this test and they can get that test and they can get that drug prescribed and they can do this, then that's better, right? So they will order the tests, they will order the drugs, they will order the therapies, they will order these things, right? Because then the insurance then pays the money for those services. So it's treating your health care that is sent to insurance or out of your pocket to pay for. In the Department of Corrections, these contracts for private health care flip that entirely upside down. There, we are paying these companies a per day rate of, I think it's above $30 a day now, for every man, woman, and child in the Department of Corrections. We're paying them up front and giving them all of the money and all the profit up front. And then when somebody that's in the Department of Corrections needs to go get care, they're going to get care. But now the provision of that care is coming out of the pocket of the money that's already been put there by these providers that was given to them by the state. So they reverse the incentivization of treating people. So now it creates profit in the free world to get good medical care. It creates a loss of profit inside the Department of Corrections under these contracts. That's why it's the incentivization model is different. So even if they do get medical care and the court orders and stuff, this is still the basic minimal level care that is found in the community to remedy these situations. So we're not talking about great healthcare here. We're not talking about gold key healthcare. We're talking about minimum level.